This is Donna Craig. This is my didactic head-to-toe physical. I am leaving stuff out on the counter, and that's simply because fishing it out of something or out of the cubbies is too far away and would take too much time. And we are scanning the room. Okay? And the first thing that I do is inspect the skin on the arms. I note a tan line and some male pattern hair distribution. There's a bit of a scrape on this finger, and there's a scratch here. And otherwise his arms look good, and temperature is appropriate for having been outside on a 90-degree day. And color, temperature, texture, and then I check turgor, which is good on that side and good on that side. Sorry for pulling that. And then I look at his legs, and there's a macule there and the remnants of some bruising and scraping related to his current employment. And once again, we're a little warm, but that's related to the 90-degree temperatures outside, and he does have a little bit of a tan on his legs. And so that was color, temperature, texture, more male hair distribution, and he is appropriately hydrated. Then I look at the fingernails, and I note that they are clean and cut short. And they're a little pale, and there's something there. And I'll check capillary refill. And it is less than 3 seconds. And then you can put your hands in. Oh! Put your fingers together, one pair at a time, flat, so that we can see the little diamonds. Go ahead. Next one. And I note no clubbing. Nails adhere to the nail bed, and the nail angle is greater than 160 degrees. Thank you. And then we go to the feet and the toenails, and they're a little darkened and thick, as seems to go with age. And then I check capillary refill. Here is also less than 3 seconds. And then we go to the head, and I note that his head is symmetrical, no odd bumps or dents, and he does wear glasses, which will come off for a moment. And I palpate the paranasal sinuses. Let me know if any of this is tender. Okay, and I note that he has male pattern hair distribution, and his hair is gray, mustache, eyebrows, and the hair on his head. And I note that he's also tan in his male pattern baldness. And then we go to, I'll go behind you. Please close your eyes. And this is going to be soft, and this is going to be sharp. Can you feel the difference? Okay, so tell me which it is when you feel it.
Soft. Sharp. Soft. Sharp. Soft. Soft.
And then I palpate the temporomandibular joint. Clench your teeth, and then open your mouth, and move your jaw side to side, and close your mouth. And then that tested the sensory and motor functions of the trigeminal nerve. Then we're going to do some gymnastics, and while you have your eyes closed, keep them closed and I'll try to open them. Okay. Now, smile without your teeth. You can open your eyes. Smile with your teeth. Puff out your cheeks and purse your lips like a kiss. And pull your eyebrows down. Then raise your eyebrows. And that tested the facial nerve. Okay, face, neck. And I palpate the spinous processes. And then we do a little range of motion. Head forward, head back, rotate, rotate, and then to the side, and to the side, and then shrug your shoulders, down, and then shrug against resistance, and down, and that is the accessory nerve. Then we go to the eyes, and I inspect the eyes. I need to look. Conjunctiva is pink there, and is pink there, and the eyelashes are curving out and away from the eye. Eyebrows are fine. Close your eyes for gently, just so I can touch, and I can palpate the lacrimal sac and the lacrimal ducts. And then I note that we would test distance vision with the Snellen chart at 20 feet, and then the Rosenbaum chart at 12 inches for close-in vision. And now we're going to test peripheral vision. And I think this is contrasting enough. Hold this card over your right eye and tell me when you can see the handle of the screwdriver looking straight at me.
No. No. No.
Switch eyes. Blink them, as our optometrist says. And then,
No. No. No.
okay. And then focus on the wall behind me for a moment. Now focus on the handle. And then follow it in. And that tested for accommodation and peripheral vision. Oh, thank you. And then, if you would look at my nose for a moment. And I can now say that his pupils are equal. They are round, reactive to light and accommodation. And we'll do, and this is something we haven't practiced. Look at my nose, just focus at my nose. And I cover, and then switch, uncover, and uncover. And his eyes don't move, which indicates that they are working together, and there's probably stereo vision in the process. All right, eyes. So we have now tested the ocular nerve. So now, follow my finger. And that tested the oculomotor, trochlear, and abducens nerves. And then I get the otoscope. And if you can look at my nose, I guess. to check your eye. And I have the red reflex. And then I look for the optic disc, the fovea centralis, the macula, and the blood vessels. And then we repeat on the other side. And I'm definitely not. There's the red reflex. And then I look for the macula, fovea centralis, optic disc, and the blood vessels. And that's the eyes. And now we go to the ears. And I inspect the auricle on this side and the mastoid area. And then if you could turn your head to the side just a little bit, I'm going to, turn it on first.
Might help.
And then I note hair and a little bit of cerumen in here. And then I note the tympanic membrane and the malleus and the cone of light, which is at 7 o'clock.
Oh.
And then we go to the other ear, and I inspect the auricle and the mastoid, and I, once again, look in the ear canal, and I note a little less cerumen, and I can see the eardrum, the tympanic membranes, again, intact, and I find the malleus and the cone of light at 5 o'clock. And then we're going to do a little whisper test.
Repeat after you. You're welcome.
What did I say?
Thank you.
And then we're going to do the Weber test. Tell me if you can hear it in both ears.
Yes.
And then tell me when you can't hear it anymore.
Now.
Can you still hear it
Yes.
there? Okay. And then on the mastoid process, let me know when you can't hear it again.
Now.
Can you still hear it?
Yes.
And that is the cochlear branch or the vestibulocochlear nerve. And then we go, then we go to the nose and change the tips. And first of all, I look at his nose and I note that it is straight, and he has a lot of hair around the bottom, so I'm going to use the otoscope. Oh, you would like your glasses?
No, just put them on.
They're fine. I'll get them in a moment.
Okay.
Okay. And I look up his nose and I check the septum and the mucous membranes and the turbinates on that side. Whoops. And then and I shouldn't be poking the sun, shining that in your eye. And I notice the septum and the turbinates and the mucous membranes on this side.
That
Thank you.
probably tickles.
And then we're going to do the smell test, so please close your eyes. Oh, move your glasses. And tell me, close that nostril, and tell me what you smell.
Vinegar.
And then close the other side, and tell me what you smell.
Maple syrup.
And that is the olfactory nerve. Nose and then mouth. Where's the flashlight? There it is. All right. Do you need some water?
Mm-hmm.
Okay. Water break. We're getting dry. Okay. And, yeah, just a little. I love electric beds. Having used manuals before. All right. And open your mouth. And raise your tongue. And I see Stinson duck. And the frenulum, put your tongue down and relax it. Sort of, well, stick it out. I can see his teeth, and mucous membrane is appropriately pink. And then, well, sorry, there's a worm stuck on that side, and there's a worm stuck on that side. And then stick your tongue out and say ah.
Ah.
And his soft palate and uvula move up and down appropriately. So that is the testing the glossopharyngeal and the vagus nerves, which also innervate swallowing and the gag reflex. And then we go to the lymph nodes, and Rachel just come around the side. Palpate the preauricular nodes. There's postauricular nodes, the occipital nodes. Then we get the deep cervical chains down to the supraclavicular nodes, and submental, sublingual, and submandibular nodes. Then and we go down to the neck. We already did that. Oh. Put your head forward. Put your head back. Side to side. And shrug your shoulders. Put your shoulders down. Shrug against resistance. Shoulders down. And that is the accessory nerve. Okay, now I go to the chest. I feel like I'm missing something, that's annoying. Okay, we go down to the chest. If I remember, I'll go back. And I note respiration, and Rachel, this way. Thank you to my videographer, my college-age daughter. I note on the chest his respirations are even. There's no inappropriate thrusts or heaves. And then I'm going to palpate the front, and then you're going to have to follow me a little bit. Tell me if anything hurts. And I'm not finding any masses, and I'm not finding any tumors, and I'm not finding any tenderness.